So next we'll have Schmid, who's the Deputy Executive Director at the AIDS Institute, and he's going to talk to us about some of these big issues and how that plays into how some of the work we're going to be doing in HIV/AIDS community. Thank you, Carl.
Thanks, Wesley. Did everyone hear me? Yeah. Right. So, as Cornelius talked about, the orthodoxy, is that the people who were elected was to cut federal spending. And no program is sacred. I think everything is going to be on the chopping block. I know, perhaps maybe some people say the military spending is not, but I think that's, vulnerable as well. But the people that got elected, that will be coming to Washington in January, their main theme is to cut the size of the federal deficit. And so therefore, a lot of our issues, a lot of our funding is vulnerable. And the first thing would be the $738 million that the CDC gets for HIV prevention. That's the money that goes to the states, the cities, the CBOs, for testing, behavioral research, behavioral program interventions, condoms, testing. But I think that that is one of the the programs that we're going to have to really make sure that we, one, defend, and two, try to get some increases for. We have seen some increases in the last couple of years for domestic HIV prevention programs, mainly due to President Obama's leadership. And now we have the National AIDS Strategy. And we support the goals of the National AIDS Strategy to reduce the number of new infections by 25%, to increase the number of people who know their status. And so therefore, the HIV community is advocating for increases, not cuts, obviously, to the domestic HIV funding at the CDC. And Dr. David Holbrave has put together a paper, an analysis that shows how much money is needed to achieve the goals of the National AIDS Strategy. And it's around $2 billion for prevention over 4 years. And so we divide that into 4 years and you get an increase of $515 million. So that's what we're going to be telling Congress that we need if we're going to have to decrease the number of new infections. Now we know in this day and age we are not going to see increases like that, and it is a number that we cannot realistically achieve. So we will be adjusting that number. We'll see what the president comes out with his budget in February, and thank you. But we will always remind Congress of what the need is. So some of the arguments you'll probably hear from the Congress is, why is HIV one disease getting all this money? What about the other diseases and conditions? Where is all this money going to? What is it being spent on? And does HIV prevention work? So those are some things that we have to be prepared to answer. Now, the National AIDS Strategy also calls for a focus on certain populations who are at risk for HIV. Number one, gay men. Now, I think the administration and the Democratic Congress in the last couple of years have done a good job of focusing on men who have sex with men and talking about programs that meet their needs and focusing resources on where the needs are. Well, maybe things will change now. Maybe Congress will, not look favorable on those populations. And so we have to be prepared for that as well. And what about the other populations that are most at risk for HIV? African Americans, Latino, the poor. Will the Republicans and the people in the majority care about those populations and making sure that they get funding for HIV prevention? And also, what about IDUs? For the last 15 years, there was a ban on federal funding of syringe exchange programs. And it was only last year that that ban was lifted and the federal government for the first time in our nation's history could spend money on a syringe exchange program. That is also at threat in the future. So, Congress, you have the big budget for HIV prevention that I think will be examined, but also they may look at how the money is being spent. We talked about certain populations. Well, what about on certain activities? During the Bush years, they kind of liked an increase, and we actually got increases for CDC prevention for HIV testing. Maybe we'll see increased funding for that. Maybe they'll want to reallocate. Maybe they don't want money to go for behavioral research. Maybe they won't want money for condoms. So I think those are the things that we have to be on the lookout as well. There's some other pots of funding out there, and if the Republicans were running on the less government, they were also running against the what they call Obamacare, and they want to repeal and replace healthcare reform. There's a pot of money in the healthcare reform. It wasn't only focusing on care and treatment, but prevention as well. And there's a prevention and public health fund. And last year, this current year, it's being funded at $500 million. And actually, the HIV/AIDS was able to get $30 million to fund e-chips, which we've heard a lot about, but also some surveillance activities as well. And that could be under attack, and it's going to be $750 this coming year. A lot of members of Congress don't like that funding. They feel that it's going, as Senator Enzi always says, it's going for running trails and bike trails. And why do we need that? It's already survived a close vote in the Senate this past year, and Cornelius put up the numbers of the Senate, what it's going to look like next year. So that pot of money is going to be $750 million this coming year, and in 2015 it goes up to $2 billion. But that is a large amount of money that could be and has been target to cuts. There's a lot of other, things in the healthcare reform law that Congress will want to repeal or replace. There's a lot of prevention coverage for preventive services. Medicaid, Medicare, private insurers, exchanges will have to cover certain preventive services. That's already actually implemented for private insurance companies, and they are estimating that that's raising premiums by 1 to 2%. And so maybe, particularly in the House, we'll see efforts to, as part of the repeal and replace, getting rid of the mandate or coverage of preventive services. Also, there were some programs that have to do with sex ed that were included in healthcare reform. One was a good one was a bad one. One was called PrEP, and that's the Personal Responsibility Education Program, and that's funded at $75 million. And then there was an abstinence-only program funded at $50 million. So maybe they'll want to increase the abstinence-only funding. I don't know. I mean, people want to decrease the size of the government, so why would they be doing that? But it's not all logical. Then also, when we were successful in getting rid of the abstinence-only program that is appropriated each year, we were able to get a teen pregnancy prevention initiative, and that's funded at $114 million. So I think that's also something that we have to protect. And then, as I said earlier, the administration has done, I think, we're seeing some progress on addressing LGBT issues. And Congress could, Cornelius talked about that they really did stay away from the social issues during the campaign. But who knows? They may go after what's, going on at Department of Education, Department of Justice, all the other programs that we've seen, OPM, where we've seen some movement on LGBT issues, and other sex ed programs, like the Division of School and Adolescent Health. That's $40 million.
Also, several years ago, we saw several amendments that were going after prevention research at the NIH that deal with certain populations, perhaps sex workers, IBUs, or gay men. And the Republicans have vowed to have open rules on the appropriations bills that go to the floor. Something that they had in the past and that the Democrats stopped in the last couple of years. But that means any member could offer an amendment. And so we can see them go after specific NIH research programs. Finally, so I talked about a lot of the spending issues, and I think that's going to be a big part of it in healthcare reform. But the other thing Congress can do is oversight. And particularly the Republicans now, who control the House, could call hearings, and they're now in control. And they can call in agency heads and people from the administration and ask what are you doing, how are you spending the money, why are you doing this, and try to get publicity to, for their issue. So I think we have to be prepared for oversight hearings as well. So that's kind of some of the issues that I see that's on the horizon in the next year. These are the challenges that we have ahead and the work ahead.